Just a quick update with interpretation. I believe that they are taking their breaks now and will be rejoining shortly.
And Heather, is there anything that Christy should know when letting Martine back in?
It looks like once he joins, we'll just assign him as interpreter. We touched base offline during the break, Christy and I, and she's able to see that setting now. So fingers crossed.
Thank you, Heather.
All right, welcome back, everybody. I am just getting you all into breakout rooms. If you just give me 1 second to get this all set up. Okay. So now we've got about 20 some minutes. At 2:30, we're going to be joined by the director of the Public Health Division, Miss Rachel Banks, who's going to join us to provide.
Christy, you got to unmute.
Muted. Thank you. So it's in about 20 minutes or so, we're going to be joined by Rachel Banks, who's the director of the Public Health Division, and she's going to provide a welcome and talk a little bit more about the role of the partnership and the purpose and all of that. So until then, we were going to push you into some breakout rooms just to kind of continue talking a little bit more about your interest in the partnership, what brought you here. Is there anything specific people should know? I think also if you just, have questions, if there are questions that come up about the partnership and ideas about resources or things, information that you all might need to get started in this work together. So just some informal time for you all to chat and continue to get to know each other a little bit. Does that sound okay? And I am Heather. I am not yet seeing our translator yet. Oh, there they are. Okay. Thanks for your patience. Okay. I think that is everyone. Oh, here's Connie. Okay, so we'll give you about 20 minutes just to hang out, chit chat, and we'll come back at about 2:30. Any questions before you zoom out to your breakout room?
Did we get Martin assigned as an interpreter? Okay.
Yes, yep. So he's in room 3 with Callie. Yep. Okay. Have fun, everybody.
Christy, I'll stay here to let folks in.
Yeah, I actually didn't assign OHA staff. So
Christy, this is Martin.
hi.
I did not get assigned as an interpreter. Just
you get
FYI. I got the room invite, but not the interpreter assignment.
Oh, sorry. What do you need? Here we go.
It'll be a pop-up on my side that'll tell me that I've been given interpreter rights.
Yep, there you go. Okay.
Kara, I have to laugh a little bit. I read the last bit of closed captioning in it, and she had written, "We're all going into separate bedrooms."
Yeah, we didn't get the captioner back, did we? That was the one thing I was looking for.
Is the what?
I didn't see the captioner come back.
Oh, the captioner.
Yeah.
Yeah. No.
And I'm sorry, what time are we coming back?
2:30.
2:30?
Mm-hmm.
Should I call the captioners?
Well, because they weren't on, I would have asked folks who wanted to have a captioner to maybe be in one room with the captioner. So that would be the text that would be captioned. But since they're not here, we couldn't offer that. I would have that person, if they can come back at 2:30. If we have a contact information, if we have the contact.
Yeah, I'll give them a call and see, because they were contracted 1 to 3.
Right.
Yeah, and I could send a message to the breakout rooms to see if anybody wants it. If they get back early.
Mm-hmm. Well, let's see if we can even get the person first.
Yeah.
Christy, you didn't assign the captioner to a breakout room, did you?
Unless they're Corey McKean.
I don't know who that is.
Yeah, I think.
I am just an all-care intern, just sitting in.
Hi, Corey.
Hi, no problem.
Listen to all our.
If you guys want me to take off and come back at 1:30, that's fine. Or
Yeah.
2:30, sorry.
Doesn't matter. Nothing. You know, we're just going to be chit chatting about other things and interpreter.
Okay.
It's up to you.
Oh. Well, it's easier if I just stay logged in. Otherwise, I'm going to be fighting the boys off the phone. So.
Sure.
So I just saw an email come through from the captioner asking if our meeting concluded early. So I just let them know it hadn't, and asked if they could please rejoin.
Thanks.
And Christy, I don't know if you want to kind of talk about the team a little bit, like the supportive team on the side. Like we could also talk a little bit more about our backgrounds, like kind of the way it was, phrased. We didn't really kind of get into our own public health backgrounds or anything. So I don't know if you want to do that or not, but
Yeah, Rachel, I think if there are when they come back, there are a few slides that talk about the background, and there is a slide in there about the core group. Is that what you're talking about?
Yeah, or just like, who they're going to basically hear from. So they'll hear from, kind of it's just, let them know that the implementation team is basically like you, me, and Heather, and that they might hear from any one of us, just kind of who they can expect to hear from and that kind of thing.
Yeah.
I got an email from the captioners and I told them to rejoin us at 2:30, which is what Kara said.
Okay.
Thanks, Lisa.
Mm-hmm.
allá de Puebla, pero atrae a mucha gente, no solamente mexicanos, sino de otras culturas, y que podríamos tomar como para hacer yo con el debido protocolo, pero sí podría ser muy buena idea el que hiciéramos algo más notorio en favor de que nosotros como trabajadores comunitarios estamos ocupándonos de que ellos
Cali,
puedan recibir la mejor atención.
si me das un poco de tiempo, por favor. Estuvo
Sí,
larguísimo eso. Mucho más corto, por favor, porque si
Sí,
no, no me voy a
claro.
acordar y vamos a perder traducción, ¿sí?
Sí.
Resumamos un poco. The 5 de Mayo is coming up. And I don't know if you know about it. Probably you do. But it's a celebration where, in a nutshell, I think it would be a really good opportunity to, following the proper protocols, of course, to try to penetrate, to try to take the advantage of the grouping and see if we can give it an approach from that angle. Sí, Cali, proceda, por favor, y un poquito más corto, por favor.
Sí, gracias por hacérmelo entender. Mire, yo estuvimos hace 3 días aquí en Borman, aquí en el condado de Umatilla-Monroe, atendiendo más de 1,000 vacunas para los que llegaban al evento. Por favor.
So 3 days ago, we were here in Borman, in Umatilla County, and we provided more than 1,000 vaccines for the people that were coming here.
Y entonces veo que si llegaron gente de Portland para acá, de Hood River, podemos realmente atraer principalmente lo que me toca a mí, el condado de Monroe y Umatilla.
And so with people from Hood River, people from Portland coming here in Hood River, and specifically with the group that I'm in charge of from the Monroe Umatilla County,
podríamos hacer algo que a nosotros los que participamos compartiendo mascarillas, desinfectantes, nos dieron un lunch muy ligero, pero muy bueno. Y eso pues nos mantuvo como fuertes para estar de las 6 de la mañana a las 6 de la tarde, a las 4 de la tarde.
And for us, you know, the ones that were there handing out masks and just helping out, when we started at 6 a.m. and at one point, you know, they provided a very light but great lunch for us that sustained us all the way until 4 p.m. So.
Y creo yo que entonces de nuestros trabajadores agrícolas en especial no podían asistir en esos horarios porque ellos ya perdieron muchas horas de trabajo en el invierno. Entonces no pueden faltar nuevamente por asistir a la vacuna.
And so our workers that work specifically in the fields, for example, in the farms, they already had to miss work because of that. So we can't ask of them to miss more work for vaccination in the winter.
Sin embargo, como la mayoría de lo que yo les platicaba de las iglesias que conozco, que son como 7, que son mayormente hispanas.
However, the churches that I was telling you about, and specifically 7 Hispanic churches.
Hay lugares como estacionamientos de una iglesia principalmente en la Main Street, aquí en Hermiston.
There are places here like Main and Street in Hermiston,
donde podríamos promover ese evento del 5 de mayo, que es prevención para conservarse sanos.
We could promote that event and on the 5 de Mayo to basically promote health and to stay healthy.
Y entonces sé que si tenemos nosotros como ese lunch que sería nada, porque incluso a lo mejor hasta conseguimos que Fiesta Foods, que otros que distribuyen comida, quisieran participar dando un pequeño refrigerio, ya sea el sábado o el domingo, que ellos pueden asistir, que ellos terminan a las 12 de su congregación los domingos y perfectamente pueden asistir a tomarse un lunch y la vacuna.
And so then, specifically in that case, they could probably, and in my opinion, they could perfectly, after they're done at church on a Sunday and they attend the celebration, they could definitely just go there and get their shot get their vaccination done and over with.
Por favor, pensémoslo, reflexionemos, porque tenemos que ir, nosotros no podemos pedir que la montaña venga a nosotros, sino nosotros ir a la montaña. Ese es el verdadero outreach, acercarnos más personalmente a nuestros pueblos, a nuestras comunidades.
Let's think about it, please, because we can't really expect much change to come of all of this if we are expecting the mountain to come to us. The real outreach is us coming to the mountain, coming to the communities, coming to the different groups.
Thank you. That's really helpful insight. Just as a quick pause, it looks like Christy has joined us to see if there was anything to do for the interpretation, but I mean, it's what we're doing now seems to be working, but I just wanted to ask Martin and Callie if there's a way to help get it back to the large group system.
It'd be great if we can do simultaneous interpretation.
Oh, I see. Instead of having to like wait and pause.
Right.
Yeah, I don't know. This is the first time we've ever used interpretation with Zoom. So is there something about the breakout rooms that disrupts functionality? Is that the problem?
Correct.
Oh, okay. Okay. So you can only do the dual system, the simultaneous when you're in a large group?
You can do it in the breakout session too, but you need to assign it to the breakout session as well.
Oh, you need to assign it to the breakout session. Okay.
But I guess that if it's not there, it's not there.
Yeah, I don't see it in this very moment, but that's something definitely that we can make sure is in place for next time.
Sounds good.
Okay. All right. Sorry about that.
No worries.
Okay. I'm going to step out unless there's anything else.
No, thank you for the help.
Yeah. Thanks for bringing me in. Okay. We'll see you. We'll play back in a few minutes. Okay.
Thank you.
Heather?
Yes.
Yeah. So Rachel brought me into their room because there was something about the interpretation, like the simultaneous interpretation didn't transfer over to the breakout room. So they're having to do like Martin, Callie.
Okay.
Just to help me remember. I'll make a note, but Martin confirmed it is something that we can set up in the breakout. so that carries over to the breakout rooms.
Oh, okay. Okay. I can ask him after, but did he mention if it, let me turn my camera on. Did he mention whether that was something that it meant we shouldn't use the simultaneous, that we should use the other option instead, or?
No, I think they prefer the simultaneous.
Okay.
It's just, there's something we need to do to make sure that that is happening in the main room as well as the breakout room. I guess, you know what, we didn't try it in the main room.
Well, we tried it in our test run, so I feel like it works. It's possible it's an admin setting that I wasn't able to adjust, and we might have to contact OAS for that, or choose an alternate setting, or find a workaround. But that's good to know. So thank you.
Yeah. I mean, we'll just need to.
It says language interpretation has been ended by host. Did you see that? Did you get that message?
No. Oh. Maybe I messed it up. Anyways, it's back on now.
We needed more time in our breakout rooms. We only got to half the people, and now I feel bad.
Oh, I'm sorry. I'm sorry. Well, if people enjoyed that and found it to be a good use of time, we can certainly keep that going in future meetings. Any questions that came up or highlights from your breakout rooms that anyone wants to share?
Is lunch provided?
Jess is hungry, okay. Yeah, I mean, historically, when we brought people together, we were very happy to provide lunch and even coffee sometimes. So hopefully, hopefully that will be something we can do together in the future.
I'm thinking a potluck, maybe.
Yeah. We usually did like a catered something or other, but yeah, it sounds like we've got many people in the group who like to cook. So let's do it.
I wanted to ask a question, Christy. Once we get going, are we here? Hopefully we're here to exchange ideas and to get OHA on board with health equity. Is that correct?
Yep. You're here to direct implementation of this ginormous plan that is actually bigger than OHA. This is
okay.
Yeah.
So I'm here to tell all the secrets and what we can do with them, right?
Yes.
Okay, got it. Okay, I'm ready.
You ready for that, Connie?
I'm ready.
Okay. All right. Well, if there is nothing else at the moment, Connie, that's a nice segue into kind of the last bit of time here together. We are still waiting for Rachel, so she will join us, I'm sure. But in the meantime, we've got a few slides here I'll pull up that get into a little bit more detail about the partnership, a little bit about the history of the partnership, and exactly what it is that we're hoping that you will all do together. And I also just want to invite Jennifer and Kurt as past partnership members. If there's anything that you all want to add, please do chime in. We welcome your experience on this group. So this is the implementation framework for Healthier Together Oregon. It's a 5-year plan, and this visual helps to helps summarize really what's in the plan. So like, as Connie said, the overall goal, the overall vision of this plan is to achieve health equity. And that really is for 5 specific populations. That being Black, Indigenous, people of color, and tribal communities, for people with low income, for people with disabilities, for people who identify as LGBTQ+, and for people who live in rural areas. There are 5 priorities that were identified by the original partnership, and they came together for the first time back in 2018, and they were charged with identifying the vision and the values. They were the ones that identified the priority areas. They participated on subcommittees and helped to really develop what's in the plan, the strategies of the plan. They approved the plan overall. And the 5 priorities they identified based on data, both quantitative data from our state health assessment, as well as a number of community feedback initiatives, identified the 5 priorities. So institutional bias, adversity, trauma, and toxic stress, access to equitable preventative health care, behavioral health, and economic drivers of health. So things like housing, food insecurity, living wage jobs. Those are the ways that we will advance and achieve health equity. There are 8 implementation areas, and that's really how we've organized the work of the plan. That helps to speak to both the interrelatedness of the priorities and the strategies, and also helps to organize the plan in terms of our work with cross-sector partners. We can get into that a little bit more detail at future meetings. There's a series of measures, both long-term and short-term measures, that we will be using to monitor our progress over time. So there's 16 key indicators, and then each of the 62 strategies also has a shorter-term measure that we are identifying. And the 62 strategies, that's really the work. That's where the magic happens. Circles of involvement. So the other thing about this plan is that we lean into a collective impact approach, which may be familiar kind of terminology and theory to some of you. And this is the visual that takes from collective impact. And this, I thought was helpful just to kind of illustrate the 3 kind of major groups or bodies of individuals that are working to move this plan. So the steering committee up here, this is all of you, that is the partnership. So we have brought you together to be the decision makers for this plan. You know, we've got a bus that was created. The bus is the plan, and you are all the drivers of that bus. To tell us where to go and how to get there. There's also a core group at OHA, and OHA is the self-identified backbone organization for this effort. And there are a number of folks at OHA across all divisions who are involved in providing that infrastructure, that backbone support for the plan. So that's myself, Liz Garst, Heather Owens, Kara Biddlecombe, Rachel Banks, who just joined us. Welcome, Rachel. And Leanne Johnson, the Director of Office of Equity and Inclusion, are the executive sponsors of this effort, and other staff in OHA from across all divisions. And we meet regularly to help prepare for these meetings and work groups that might be established, and communications work, and a whole bunch of effort goes into this. And again, we'd be happy to share more about the work of that group and what our role is, and to support all of you. And then finally, we have the ecosystem of community partners. And this is really where the strategy implementation happens. So, you know, this is where the work happens. This is a system, a diverse system of partners, those being coalitions, community-based organizations, other state agencies, folks who are involved with community health improvement planning. You're on the phone or in this call, or I'm sorry, on the partnership. That's why you're here. Regional health equity coalitions, all of the people out there who are really doing the work. So that is really the ecosystem of partners that that also is a part of the structure. The one piece of this visual that's missing is the community, and the community at large, and the voice inclusion of their perspectives in this process. Certainly you all will play a big role in that in terms of providing and helping with two-way communication with communities that you identified and making sure that their ideas are brought forth to this table. And then we're also interested to support larger community engagement efforts over the next 4 years and look to all of you to help inform what that looks like and when that might happen. And then finally, all of you, a little bit more detail here. So what exactly are we asking you all to do? Well, provide long-term strategic direction for Healthier Together Oregon. This is a living document, and we expect that there will be modifications and changes that are needed over time. We look to you to really inform all of that. There's a lot of work, 62 strategies. We probably can't do all of those at the same time effectively. So looking to you to prioritize those strategies and let us know which ones we get started on first. There's a large accountability role here, like Connie alluded to, right? Telling OHA, showing us how to be accountable, helping with other partners to hold accountability, determining changes, any modifications that are needed. We do have some resources for this work, not a lot, but we do anticipate that there may be more resources in the future, and your group will certainly be directing how we spend that money. Supporting two-way communication and just being an overall champion. With that, I'm going to hold questions because you hopefully have some questions, and I'm going to turn it over to Rachel Banks, the Director of Public Health Division, to introduce herself and welcome you. And Rachel, if you have wisdom to share with this group about this plan and what it means to OHA, that would be great.
Yeah, absolutely. Thank you, everyone. It's great to virtually be with you. Rachel Banks, I use she, her, and hers. And I am just super excited about this plan for a number of reasons. One, how it came together and how OHA did this version of health improvement planning different. And watching how different it looks when communities are engaged in answering a question that's not just something along the lines of, what disease do you want us to be saviors for you in this day, which is kind of how some of these improvement plans have happened before from a public health perspective, where and more is what do folks need to be healthy. And so I'm just a huge fan of the plan. It gets, and the areas that it gets to, it's not shying away from talking about bias. It's addressing racism and colonialism and a variety of other things. And it's building the sort of blocks that will take for folks to be healthy in all of their holistic health, behavioral health included, and of course having housing and all and thriving communities. So I'm super excited to see it move forward. I also think that the timing and the more, as people are starting to think about COVID and what is COVID, that's where there's a lot of focus in public health. And I just think of this is our roadmap for COVID recovery and resilience. And I'm hopeful that the more that we help people see that these are some of the strategies moving beyond, cases and vaccines and all of those things which are important, to seeing the pathway for more holistic health. And whether that's an aspiration for folks, generally speaking, or because they're really focused on COVID right now, I think there's opportunities in both of those ways. So I'm just really excited to be in partnership with you all and to continue in terms of, Christy asked about wisdom, and my thought was like, I'm here to get some wisdom from talking to you all. And I think that the wisdom, right, is in the plan in which communities have informed, and look forward to walking through this journey and trying to get as much support and funding. And forgive me for being late. I was actually just in a meeting where with other folks in OHA where we talked about our strategic goal is to completely eliminate health inequities by 2030. And so the conversation was, this Healthier Together Oregon is a pathway for us to reach that goal. And what does it look like to have the entire agency really circling around? So That was great news. And once again, thank you. I'm excited to be here. And I'm excited that you all are giving us the chance and holding OHA accountable to this plan.
Thanks, Rachel. Heather, I'm seeing your message here. I'm not totally sure. Is there something I need to do, Heather, for the interpretation piece of it?
I don't think so. It seems that Callie's having a hard time hearing the interpreter on her end. So I just thought we could pause for a quick moment and point out the interpretation link in the bottom of the meeting between share screen and reactions. I don't know if we can do a shared screen and point it out, and that she would need to select the Spanish option there in order to hear Martine.
Yeah, I am not seeing that on my end, unfortunately.
Don't worry, I can understand everything. Just because it's not easy. I don't know why it's not functioning. The interpreter, but when I put in Spanish, it's not functioning. And then, don't worry, go ahead because the time is on. It's over.
Callie, thank you so much.
No, you are very kind with me.
We're learning. We'll get better, I promise.
Yes, don't worry. Go ahead. We continue because it's very interesting. Everything.
What questions do people have? I'm sure there are many.
Okay, I have another question. I'm not trying to monopolize first and foremost. When we bring back ideas, suggestions, comments, criticism, that would be based on our community, the community that we are in. Because I have worked with other organizations and they're not based in the Illinois Valley Cave Junction. So we don't have a lot of, we only have one doctor up here. So my challenge, I think, will be to get another doctor or a healthcare facility up here where people can feel comfortable and safe in going to. It's unfortunate she works 4 days a week. So that Wednesday is when I usually get sick. So I have to go to Grants Pass. And that's not fun. You know, you don't feel good and you're driving 45 minutes to get to a doctor. And I've had it happen before. And my goal probably with the partnership is to get OHA to kind of think about having another clinic besides SKU and one doctor's office. That would be one of my goals. And my other goal would be to basically bring some of the good services that are up in different counties to our county. That wasn't a question, was it? How do I do that? There you go. There's a question.
Yeah, no, I think that's great, Connie. I mean, I think it sounds like you're speaking to a lot of the strategies that are identified, particularly within the Healthy Families implementation area, and that came out of the Access to Equitable Preventative Healthcare subcommittee. And yeah, so helping us to prioritize those strategies and lend your ideas about what that would mean in terms of provider access. And yes, we look forward to that conversation with you. Sounds like you have some great ideas.
I do, just a few. No, I was just wondering if, you know, once we have all these things going, how do we implement? And I would like to be the spearhead to that. I really would for this Illinois Valley, because a lot of people, they do need help, but they don't come forward. I have a lot of people who are Latina and who don't speak English very well, so they kind of isolate in their homes. I have people of color who don't trust the system, so they isolate in their homes. I have people who are elderly who don't trust the doctors here, so they isolate. So it's just a pattern, and I would like to see somebody besides me put on another cape and help me fly through this area and get these services in place. I am not going to take up everybody's time. I'm going to get off. Goodbye.
I would have a question. What is the best way to get my arms around what it is that we can do to be the greatest help? Is it mainly going through the website, or are there other sources that I could access to be better prepared to be effective?
Yeah, I mean, Stan, certainly there are lots of resources and links and things. You know, there are also, you know, we will be looking to all of you to determine how you want to use your meeting time. How often you want to meet, what exactly you want to do in meetings versus outside of meetings. So I think there's a lot of different ways that we are, you know, we're here to help you and provide the information and resources you need. And I think that will be a big focus of the next meeting, is to hear a little bit more specifically about what those resources would be. Are they specific to strategies, or, you know, priorities, or just overall framing, definitions, you know, more of like an organizational overview of state agencies? And so there's a lot of different angles that we could take, and hearing from all of you what would make sense would be really helpful. And we'll definitely make some time for that at the next meeting. But in the meantime, we can certainly send some resources along to get you all started. And if other folks have ideas, particularly those of you who might already be involved in community health improvement planning, and if there are things that have been helpful for all of you in your efforts, that would be great to share with one another.
When we look at the pyramid that has the priorities, starts at the base of the 62 strategies and works its way up, I think the thing I'd be looking for is a way to not categorize, but a way to prioritize the priorities or prioritize the strategies. And, you know, are we looking for, like, how do we, 62 is a lot of strategies. How do we how do we prioritize and address within that family of 62 strategies that's on the base of the pyramid? I'm sure someone has a plan.
Great question. Yeah. Would love ideas on that, because it certainly will not be an easy task. But yeah, hearing from all of you, like, what is the right amount of information to get everyone kind of on a level playing field about the strategies, in order for you to make the prioritization decisions. That would be great, because we, you know, we're trying to not put a lot of timelines on this work that, you know, aren't directed by you all, but we do have some funding timelines. We do have a little bit of funding from the CDC for this work. Some of that money needs to be spent by October 1st. So there are some things that we'll be asking you to do here in the short term. So, you know, thinking about what kind of information and the level of information you need to make those decisions would be really helpful.
I've been clicking around the website that you posted, the Healthier Together Oregon, as you've been speaking, and found the draft implementation plan for year 1. And I noticed, so I'm wondering, one question is, should we all review that and like decide, yes, we're going to continue implementing this plan, or when does this plan end? I also noticed that a lot of the short-term measures are still to be determined. So it sounds like there's a lot of work there. And I'm also super curious if you all could give an update on the bill that's in Salem right now to declare racism as a public health crisis. You call that out in the plan, and I know that's been moving through Salem. I'm wondering how it's doing. I know you all can't advocate, but we all can. So if it needs some additional testimony or folks to speak to the importance of that bill, please let us know.
Yeah, Kara or Rachel, do you want to quickly speak to kind of where it's at?
Yeah, and I believe, Kara, you were at the last hearing?
I wasn't, but I looked it up to make sure that I had the latest, which was what I was remembering. So Veronica, thank you for the question. It's House Bill 2337. I'll also write it in the chat. So if anyone wants to read it, they can, and I'll give you the link. So this bill does declare racism a public health crisis, which, as you pointed out, is one of the strategies included in Healthier Together Oregon. The bill also does a number of other things related to Real D data collection, establishment of mobile health units. There are a lot of other components that have gone along with declaring racism a public health crisis. And the bill did go from the healthcare committee on the House side over to rules, where it had a hearing last week. And so that's where it's currently sitting in the rules committee. Bills that are in rules, just like Ways and Means, get a little bit longer time frame to have movement. So I think maybe what we can do for future is continue to either share information via email or at these meetings as we go through session, knowing we still have a few months left and we can keep you apprised. Rachel, feel free to add anything else that I missed with that one.
No, I think that's great. Thanks, Kara.
I do want to say this is Esther from OHE. So I sit on the task force for that specific bill. And so if folks are interested in giving testimony, I'd be happy to. I don't know if there's like a listserv for this specific group, but our meetings are on Tuesdays. And so I can let them know that I'm connected to folks in this space to, if you all want to be let known of like opportunities for testimony.
Thanks, Esther. We could definitely send out kind of in roster and contact information for you all after the meeting, so you can get in touch with each other. Okay.
I was going to add one quick thing on the implementation plan, just for context. So just so you know where that came from, that basically came from the initial ideas out of the subcommittees. So while we gathered 100 people from 68 different organizations as we created this plan, there were different activities that people, proposed to make them, to combine into more general strategies. So we really just wanted to make sure that we captured all of the ideas from the subcommittees while we had folks around the table. So just to give you that kind of quick understanding of, that's where that particular year one implementation plan that's posted on the website. And we have done some work since then, but that's just kind of the initial ideas that we wanted to make sure that we captured and carried forward.
Para mí sería bien importante que nosotros, como ahorita ya vamos avanzando, creo que en mi caso yo tengo la gente con la que trabajo que está muy dispuesta a ser parte de esto. Podemos empezar si yo me conecto con Verónica, como ya me han propuesto, tener los kits y yo ir avanzando en esto, porque la cuestión es como ir enamorando a la gente acerca de la importancia que tenemos de que ellos se conserven sanos y que puedan seguir su vida normal de trabajando, disfrutando de una buena salud. Si me permiten, eso sería lo primero para mí.
Martin, are you available to interpret what was just said?
He was interpreting. with the English option on interpretation would need to be selected to hear him.
Shoot, I see.
¿Estás ahí, Martín?
I am here, Cali. Yes.
Would you be able to repeat her last statement, Martine? I don't think everyone had clicked over yet.
Whoever's in the English channel and can hear me, could you please let Cali know? She can't hear me when she goes into the Spanish channel. So let her know that she needs to repeat what she just said so that I can reinterpret, please.
A ver. Yo lo escucho claramente. Sí. Bien, que para mí
So for me, it would be very important that since we are here, you know, advancing, that if I can agree and get together with Veronica on basically the indications that I was getting for the kits that I'm requesting, that I would like to start to implement this so that we're not stagnant here, so that people can begin to feel like we are taking care of them.
Creo que otra vez se volvió a salir, ¿verdad?
I think that people didn't hear me again. Maybe I'm being able to hear everybody, but nobody can hear me.
No, we can hear.
We can hear you.
Bien, pero sí les tradujo entonces usted.
Oh, so then you interpreted, right?
Yes.
Okay. Okay, muchas gracias.
Oh, great. Thank you very much. Okay, so I just want to make it clear and drive my point home that the people that are a part of the Guatemala people, they've already called me asking, where can we get the vaccine? So I think it's mostly so that their leaders can receive this kit so that they can as well have access to this. So in another way of saying it, so that it's easier for them to access them. The vaccinations are ready. All we need to do is huddle everybody together. Thank you. What do you all think?
When we can make connections on April 5th, we've been working to pair vaccines with community-based organizations or community-specific or faith-based organizations in local communities. And so we've done an initial survey to ask who would be interested, some faith-based or community-based organizations, and we're working to make sure that we can get those vaccines matched, and that OHA will be a matchmaker if you have somewhere, you know, just like Callie said, to gather up the people. We want to know where that place is, and if needed, we'll match folks with either the county people. Sorry, someone's at my door. I'm gonna run here in a sec. Or the or if there's a health system partner that needs to be included as well. So that is coming very soon to be able to do that, and we'll send information so folks are aware of that process.
Gracias. Gracias. Thank you.
Thank you.
Thanks, Rachel. Okay, y'all, thank you so much. I am just super excited about what is to come. You will all convene again. I think it's May 1st or 3rd. And we'll send some materials out in between them. We'll share the implementation plan. We also have a link of legislative bills that are HTO related. That sounds like that might be of interest. We'll share a contact roster so you can all get in touch with each other outside the plan. And we will make space to hopefully highlight some of the other questions and things that you all raised at the next meeting. So please, you know, contact myself, Liz, Heather, Kara. We're all here to support you and make these meetings meaningful for you. So thank you so much again, and we'll see you in some weeks.
Muchas gracias. Thank you. I love you.
Gracias.